Hello, it's Dr. Rhonda Johnson, and today is Saturday, October 2nd, 2021. I want to first start off today by acknowledging a very sobering milestone. More than 700,000 people have died from COVID here in the United States. Now, if you were to put all of those bodies in Heinz Field, it would take 10 Heinz Field stadiums to find a place for all those people who have died. Now, when you look at the global statistic, more than 5 million people have died in this pandemic. We have really got to turn this around. Sometimes I think about the numbers and I wonder, are we numb to these statistics? Are we numb to 700,000 deaths? Are we numb to 220,000 people dying a day here in this country? Are we numb to 5 million people who have died from this pandemic worldwide? People want one simple trick to end this pandemic. However, sadly, there's no one simple trick. You may say you have pandemic fatigue, but we know the virus does not have pandemic fatigue. No viral fatigue. It's just waiting there, fatigued or not. You know, I read a lot of medical articles and journals about the virus and the treatments and the epidemiology. And one noted Harvard epidemiologist predicts that in the next 6 months, everyone in the United States will either have been infected with Delta or either they'll be vaccinated. Now, at the rate that we're doing with vaccination, it doesn't seem that that's likely. This deadly coronavirus, folks, is here to stay. This is what 89% of the world's top scientists, experts, virologists have said. In science terms, this means the virus has become endemic. Now, what does the word endemic mean? You've already learned the word pandemic. An endemic is a disease outbreak that is consistently present but limited to a particular region. So, for example, I did missionary work in Haiti. Malaria is endemic to Haiti. And when I did the mission work there, I took anti-malarial medication to prevent getting infected. Same thing as if you travel to an area where yellow fever is endemic or typhus is endemic, you have to take vaccinations to help you prevent from getting these infections. So now we add one more endemic virus to the world, and that's COVID, because we have billions of unvaccinated people, multiple animal reservoirs for this virus, and because even fully vaccinated people can still experience breakthrough infections. But there's some good news. The vaccines do work. The COVID-19 vaccines continue to be very effective in reducing the risk of severe disease, hospitalizations, and death across all the variants, including the world's highly contagious, raging variant, the Delta variant. We continue to see protection for people who are vaccinated against the worst outcomes. And I certainly can attest to that as I am recovering from my own bout of COVID infection. Again, I read a lot, and another physician who wrote an opinion piece said that over the next decade, every single person on earth will have a date with this virus. We're all going to be exposed. Some will get very sick. Some may die. Some may only get mild illness or not get sick at all. Now, as you know, I've had my own encounter with Delta, and it was not pleasant. In fact, it was one of the worst experiences I have ever had with an illness. And like some people, I have some lingering side effects, which should improve over time. But hear me loud and clear. I met this virus on the best terms for my age and personal health risk factors because I had 2 doses of the COVID-19 vaccine, and I have lived to tell you this story. So if you are an adult and have not been vaccinated, I hope that you'll get a COVID vaccine as soon as possible. If you live in a location in this world with limited vaccine availability and you are older or vulnerable because of health reasons, please continue to take precautions for yourself and your family as best as you can while you wait for a COVID vaccine. I always want to remind people that here in the United States, the vaccine is free. It's available in many locations, including Walmart, neighborhood pharmacies, some doctor's offices, most qualified federally qualified health centers, and many other locations. And if you're not sure, just text your zip code to 438-829 or call 1-800-232-0233 and you can be vaccinated. I know we're learning to live with this endemic virus. We're having weddings, parties, attending sports and live theater events. Some workplaces are returning back to the office. Life continues on. Our kids are back in school. We're visiting our loved ones in long-term care facilities. Some of us have an acceptance that we are going to live with precautions and vaccinations as the price of staying alive and living with meaning and purpose. Our new normal is here. It's been here for a while. And the future is going to involve increased COVID testing, as it should. Those that want to continue to live healthy will wear our masks. And vaccine mandates are going to be controversial, but here in the United States, the legal system will weigh on the side of vaccine mandates because we're in a public health emergency, I predict. Now, the cold season is coming up soon here in the half of the earth that's north of the equator. Experts say that this virus is more lethal in the cold winter months due to lower humidity and the fact that people are indoors and there's less open cross ventilation. So we have to get ready. Please get a booster if you're eligible. If you need guidance on boosters, you can see my YouTube video recorded September 25th. And for, again, the unvaccinated, please get vaccinated. Experts predict another 100,000 people who are going to die this winter. Please try not to be in this group. You know, talking to people who are opposed to the COVID vaccine sometimes seems like a waste of time. But people sometimes do respond to our messages, and your message might just be the one that changes a doubting mind. After all, we are all our brothers and sisters' keepers. So that's my message today. Stay encouraged, keep fighting, keep taking precautions. This is real. This is not fake news. This is not a made-up crisis. This is real. Be safe. And as always, my views are my own, and have a blessed day.